You're live.
Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting for January 25th, 2024. It is roughly 4:01 p.m. I have a roll call, please.
Mr. Pig,
I am here.
Mr. Beal,
Here.
Ms. Stidham. Here. Dr. Henry. Yes. Ms. Davis. Here.
Thank you. A quorum has been established. Mr. Deal, would you please read the mission, vision, and purpose?
Happy to. The mission of the Jefferson County Health Department is to champion positive health outcomes and behaviors through innovative programs and community engagement. Vision of the health department is advancing the health and safety of Jefferson County. And the purpose of the health center, as written in the revised Missouri statutes, is Jefferson County Health Department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you very much, sir. We now have the approval of the agenda. I have a motion to approve the agenda, please.
I move to approve the agenda. A second.
First and second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. Any opposed? Motion carries. I do not see any guests.
That was an aye. I'm sorry.
That's all right. I figured that you made the motion. Legal paper here's, I don't see any other guests. So the next on our agenda is approval of the November 30th, 2023 meeting minutes.
I'll motion to approve.
Have a first on the approval. Do I have a second?
I'll second.
Having a first and second, is there any discussion on the matter?
Mr. Chairman, I've got something here, I'm not sure which day it is. It would be the December, wait. Yeah, so you're asking for November, correct? Okay, go ahead. Sorry.
There's no other discussion. All in favor for the accepting and approval of the November 30th, 2023 meeting minutes, please say aye.
Aye.
Any opposed? Motion carries. Next is approval of the December 21st, 2023 meeting minutes. Do I have a motion to approve?
I'll make motion.
Second.
Have a first and a second. Any discussion?
Mr. Chairman,
Ms. Davis?
I just wanted on record that I didn't admit that I had fully discussed the objections to the changes that were being made on the bylaws. In the minutes, it does use the word that Ms. Davis admitted she fully discussed her objections, and I didn't. So on record, I didn't admit that. So, and then the next thing is act on recommendation to approve the 2024 employee base raises. And it mentions that we're only going to offer the employees $1 an hour increase, but we were going to offer the salaried employees a 4% increase. And where will I be able to discuss that? Can I say something about that right now? Because it was mentioned,
So these
I
are,
have $10 an hour raise for the employees by me.
so these are minutes of the meeting. So all that was already approved and we acted upon that and approved that. So there's really no further discussion on that matter. If there's something you feel that's in error, like when you voted, maybe you voted no and you meant yay, or you voted yay and it was supposed to be nay, or other discussion points that are in there, but if you can't really go back and relitigate this because it's already done.
Well,
I
on
don't-
record, I want to state for the record that I'd like to see a minimum of $10 an hour raise for all of our employees, not the salaried ones, but for the employees. I think that if we don't give them something like that, they're going backwards. They're losing money. The economy is terrible.
Well, I understand where you're coming from, and I think everybody here wants to, make sure that everybody's paid properly and appropriately. But $10 an hour raise across the board would really be inappropriate at this time as far as I can look, because we are in the midst of doing a salary.
$200 a week, Mr.
Can I
Chairman,
finish,
basically.
please?
Yes.
We are doing a salary survey across the board to see where we're at with people. We need to let that get finished.
$1 an hour won't even help them. It's.
The salary survey is in process so we can make the adjustments necessary going forward. This was put in place just for this past year, just what we've done. Anything with the salary survey is gonna be something we can do in the future when it comes back. Let's let that process go forward and come back, and we will get recommendations on which areas are down. Now, I know from a lot of discussions we've had, we know there's quite a few of our areas and our employees that are underpaid, but we have to go through the process and make sure that we're balancing this out. We can't just arbitrarily give that, because that would be a devastating effect on the budget. That's a lot of money.
On the budget, but we've got the money, we just don't.
Well,
have
I
the
don't know if
budget.
we really have that money in there. I'd have to, defer to our comptroller on those kind of issues. And, do the market, because when you do a raise, before you give the raise out, and I mean, Christian, you talk about it, you go through and do a farmer to make sure you can cover that. Because, it's just not the raise, it's all the other stuff that goes with that. So I understand what you're trying to do. But again, let's let the salary survey go through with that on this. Now, as far as that, if you want to, you can, that'll be part of this minute. So what I need is, for the minutes that were done this, on the, December 21st, we need an approval for that. So not hearing any other, is there any other discussion on the issue of the minutes? Not hearing any, all in favor of approving the December 21st, 2023 meeting minutes, please say aye. Aye.
Right.
One opposed, motion carries. Okay. So now we're on to the approval of the December 2023 expenditures for an amount, hold on to your hats, for $2,011,792.47. Now, before I ask for any motions, I'm going to explain what that is about. There is a $1.9 million check that went in onto this check register for our down payment for the loan and the building that we're now building. So it's $1.9 million. Just so everybody knows that, it is a big dollar, but that's what that was about. So do I have a motion to approve that?
I make the motion.
Do I have a second? I have a first and second. Is there any discussion points?
Mr. Chairman,
Ms. Davis?
are you asking about discussion on these or on that particular line item?
Well, on the December 2023 expenditures,
Okay,
that entire expenditures of that December.
okay, that's it, yes.
Do you have a
So, yes, I
discussion
do.
point?
So, our attorney, Chrissy Coleman, her bill this month is $11,448. Again, 4 years ago, we were, and COVID's over with and all that, I think that the attorney fee shouldn't be more than $2,000 to $3,000 a month. That's my personal opinion and for what it's worth. So we're like 4 or 5 times more than that. The line item that Mr. Pig was just speaking about, I have that underlined. It says Jefferson County Health Department, 20% down payment on the building loan, $1,913,000. We own that ground, and so I'm wondering why we didn't leverage the ground instead of giving them a down payment for the loan. So that's whether everybody wants to discuss it or not, I think that's a lot of money. I would have tried to leverage the ground that we already own, so, that's all I have to say, sir.
Are there any other discussion points? Not hearing any, looking for approval for the December 2023 expenditures. All in favor, please say aye.
Aye.
Any opposed?
Nay.
Motion carries 4-1. Now we have approval of the December 2023 electronic payments for an amount of $466 $1,643.99.
Make the motion.
Second, or having first and second, any discussion points on the December electronic payments?
Mr. Chairman,
Ms.
there
Davis.
was one that I saw that I was like, what is that? Let me see if I can find it again real quick. AXA for 7,000. Or 45.95 actual amount. What is AXA?
That is our employee funded, retirement. So that's just
Gotcha.
now.
Okay. Retirement. Okay, thank you. Appreciate that.
Any other questions? Not hearing any, all in favor of December 2023 electronic payments, please say aye. Aye.
Aye.
Any opposed? Motion carries 5-0. This will be pre-approval of the February 2024 electronic payments for an amount of $602,365.52.
Make a motion to pay. Second.
Having a first and second, is there any discussions?
Yes, sir. But doesn't it usually run around 400,000 a month? Why is it 600,000? What's making it so much more?
You
So
wanna,
it's typically at that 602 is what we've been requesting, and we generally end up only spending the 400 and something.
Yeah.
So that's.
Oh, okay.
That's just the maximum.
Okay, yeah, I'm seeing that right. Estimated and actual. Thank
just give
you.
a little room in case something comes through, so. All right, not hearing, is there any other discussion points? Not hearing any, looking for a free approval of the February 2024 electronic payments. All in favor, please say aye.
Aye.
Any opposed? All right, motion carries. Director's report. Ms. Smallman.
Start with the clinical services report. Good afternoon. You have your December clinical board report in your packet. A lot of the full year data and reporting from our clinical perspective will be highlighted in the annual report. So I'm not going to give you double data there. The one thing I would like to just point out is that we did post our request for proposal for a design and development of a new mobile healthcare unit that was posted in December, and it was closed out on January 22nd. So we did get bids for that. So the next step will be to evaluate those bids. Just wanted to make sure that you guys are aware that we did take that first step in the process, and we did receive some response to that.
So in our fleet of vans, how many will we have? How many would we have now? And then with that one, how many?
So this request for proposal is for the replacement of our mobile healthcare unit that we no longer have in the fleet, where we previously had performed primary care services with a nurse practitioner and medical staff directly in the community. Right now, as I've listed in several of these reports, they're using a Sprinter van and is not conducive to primary care. There's no bathroom on board. And we do have grant funding for this.
Yeah, so that one added to what we have, how many do we?
I don't know the answer to how many are in our actual fleet. The fleet isn't under my services.
Okay.
Is this the one that was wrecked?
Yes.
That's the one.
Yes. Yep. Any questions about that? Okay, that's all I wanted to highlight from a clinical perspective.
Thank you.
Thank you.
Chairman, I'd like to speak that medical unit go around to the county for the homeless people
Well, we'll
in the future.
understand it. Let's let the operations and the director and others make those decisions.
Okay.
Can I respond to that?
Yes. ma'am.
Yes.
We already do that. We are at the unhoused events. We are taking our mobile healthcare services to food pantries, peace pantries, to farmers markets. So
Yeah.
that is part of, the access to care initiative for this program.
Yeah.
Thank you.
We were at a meeting, there was a collaboration of the health department was there. And I got to speak to one of the ladies that you guys sent over. And, what I think would help, you have to have somebody with you from the community, but you have to go to the actual encampments. And then somebody goes down and lets them know you're out there, and then they can come up and get care. They're not gonna show up at any of the events. They don't have a car, they don't have transportation. So that's just my thought and my suggestion.
Thank you for your suggestion.
Just as a clarification, I'm not sure who you met at the event. We do have a couple of.
Long
staff
dark
who are-
hair.
Jillian.
Yeah.
I would say, who are heavily involved in those efforts, and actually they do go out to the homeless encampments. So,
Oh, good.
that is part of the work that they do. For the next report, I'll ask for Ann, Health Communications.
Okay, your health communications board report this month looks a little fair, compared to what it usually is. Our Google Analytics, which measures like all of our website data, not data, but like gives me basically all the things that say, hey, this is what you need to do. It broke. So, not on our end. I'm gonna blame Google. I'm in the process of repairing it, but I didn't realize it until the end of December, and then I was like, oh, I only have like 10 days worth of data. So I didn't put December's like website data in here. Not that you guys are probably like super whatever with that, but I just wanted to give you a heads up. That's why it looks smaller. YouTube though, they got their stuff together. YouTube's on there. Otherwise, the main things that were highlighted here was the winter community outreach event, which is actually one of the events that Melissa and Kelly were just talking about. It's one of the ones that Jillian goes to as well. It's where they put all the folks, all the resources and stuff together. So it's kind of one of the bigger ones where instead of going to like the encampments, it's more like in an area close to an encampment, and then they provide like a shuttle service, which like you said, you know, there's sometimes you're gonna hit and miss things. But when I think they had over 30, what did I put in here? They had 30 or 20 plus agencies. So with 20 plus agencies all together at once, it's kind of hard to get all of them down there. So I know independently, a lot of folks do it that way. These are kind of more like the, I don't know, like the mom events where like the little baby ones go out. That was a terrible analogy. Anyway. So yeah, there were 38 community members that were there, and then they served 120 hot meals. So this was in partnership with the Salvation Army, and there's a bunch of different folks there. Actually, David Alametti, I can't say his last name correctly, from channel 2. Hopefully he's not watching. I can't remember. He came and did a story on it and everything too. So that was kind of cool. Yeah, so good. Public Health Core Competencies Project. We are working through that to utilize some of the contract or the state funding that we received to make sure that our staff are getting the workforce training that is appropriate, what we need to work on as an agency, and then individual departments, like if they are something specific that they want to work on. Those are pretty much the main points. December was kind of a slower month for us. And then, like I said, daggone Google broke, so that's what I got. Health. Annual report, just finished that this morning. So once I get that turned into the county and everything, I'll have that for you guys next month, and we can take a look at the fun stuff. So any questions for me? I think so.
Thank you very much.
Yeah, thank you. Okay, and then the community services report is included within the packets. You will not be making a presentation today. And that will be it.
Good, okay. Next on our agenda is public comments. There's nobody here for public comments, so we'll move on to next portion with old business, new building updates. I know Steve's not here. I don't know if I have anything on there. I know we have something down later, new business. Is there anything, Kelly, that you want to report on? Or?
Just this one. And just letting folks know that construction has begun at the site. Equipment has arrived and the excavating has started. They encountered rock on the east edge of the property, which is affecting the depth of the stormwater drains and utilities. The architect is currently working with civil engineers to develop a new location for the stormwater drains and utilities to help reduce the cost of the rock excavating. We don't have a final plan or cost yet, but they are in the process of getting that to us. They believe that the work that they are doing with the civil engineers might help to actually reduce some of our costs based upon some of the changes that are needing to be made. Our monthly construction meeting was held on January 11th and again this morning. Our main discussion was around the groundbreaking at the January 11th meeting and then looking into some of the testing requirements that we need to be able to move construction forward was this morning. The groundbreaking ceremony was held on Wednesday, January 17th. There were 26 people who attended the ceremony, including all of our board and our administration. And just letting folks know that we have a site up now on, is it on SharePoint?
So it's
Sorry.
on our internal site, but the website should be up, the page on the website should be up by Sunday. And then once I get some of the video footage edited, we're gonna have a section on our YouTube channel too.
Great.
Very excited about
And
it.
that's of the grand opening.
It'll just be the progress for the whole project. So I plan to go as often as Sykes will let me. And take photos and video and just kind of get updates. That way the public can see, because you know, folks live up north. They may never come down this way, but they still want to know.
That's awesome.
And I'm kind of that person that likes to document, so I'm pretty excited about it. But yeah, there'll be a page on the website. And then as well, I'll kind of dedicate a section on our YouTube channel for updates, so.
If you need actors or props, let me know.
Yeah. Tammy's been really great with that.
All right, next on the schedule is update on HR audit.
I apologize. I did not have a chance to ask. Have we heard anything?
No, I just got an email back from council. They don't have a response back to us yet. So you want me to, let me see for that.
Sure.
Okay, so we had hired a vendor that the state recommended to us to conduct a multi-part audit that included reviewing all of our job descriptions, auditing them, and there's a process that's involved in auditing them, make sure that they're current and accurate. And then from those job descriptions, you develop performance evaluations that line up with what's in the job descriptions. And also to conduct certain trainings for us and to conduct a salary survey. We got preliminary results back in from that service and we're not pleased with the quality of the work that we had received as drafts from that service. So we are in the process of trying to negotiate getting refunded back a portion of those fees so that we can then turn around and hire a different vendor that can actually come in and audit those services for us and get you an accurate salary comparison. We could give you what they've provided, but frankly, it's not gonna be worth the paper that it's written on because it's not up to date. And if you don't have up-to-date job descriptions, your salary comparison is not gonna be valuable to you either. So we're kind of in a wait and see pattern. I've been on the phone with their counsel this week, trying to negotiate a refund of a large portion of those fees for us.
Can I talk about next steps? Okay, based upon the need to stop working with that particular vendor, we went out to bid for additional HR consulting services. We sent them to 10 HR consultants and received 5 bids back. The bids that we received are able to expedite and get the work done within the time period that we still have left. It is grant funded. And so I've received approval from the state to be able to allocate the funds from our existing contract to be able to cover the 2 new contracts. The first contract would be looking at doing the job descriptions and performance appraisals. They will work in tandem with a second vendor who will be doing the workforce compensation survey. This will enable us to be able to continue to try to get those 2 processes, which are usually back to back, done almost in tandem. The 2 vendors will work with triaged our most critical positions in terms of turnover. We'll begin with those divisions first and then work our way back down through. We still anticipate the completion of the project by June 30th, but we have talked with both vendors. They are ready to go as soon as possible, and we did receive approval today from the state to go ahead and utilize the current funds we have in our grant to utilize or to start the process.
Were the original funds, we paid them from a grant?
Yes.
Any other questions on that matter? All right, we're gonna move to new business. The first on that under new business is act on recommendation to approve increase to the attorney hourly rate. Do I have a motion?
Hell no.
Ms. Davis? Please.
Who made the recommendation? Who's the recommendation coming from?
I requested that it be placed on the agendas for open discussion.
So I'll make a motion that we can discuss it.
Is there a second to that?
I'll second.
Having a first and second, we'll now open it up to discussion. Mr. Deal, if you'd like to, is there anything you'd like to discuss first since you made the motion on it?
Could you give us more information, please?
Sure. So when I was brought on in September of 2020, the hourly rate that was established pursuant to retainer letter was $2.80 an hour. And under that retainer agreement, I had the ability to increase the rates yearly between 7% and 10%. I have not asked for a raise since I started working with the health department. What I'm asking for is a raise that basically would true up as if I had been doing 7% each year, the minimum under the retainer agreement, to true that up to $3.45 an hour. Which I think can still be, you still get, is reduce the budget for legal fees. You don't have any pending litigation with our firm. There are no IP projects with the firm. So I don't think that will be any issue in staying in the budget, even with the raised rate. I did some comparables. It's difficult to kind of compare apples to apples because a lot of different public entities have different types of legal fee arrangements. Some of them will pay a $5,000 a month retainer, and that just gets you like an attendance at a board meeting, but then anything else costs you an hourly rate. Other firms in the area, two of the larger firms in the St. Louis area that represent public entities, they're around $400 an hour. And that's their base rate. So I've got some comparable information, like for example, I was able to pull from newspaper articles what St. Louis County spent just on the Robinson piece of litigation, for example, which we capped ours at 10,000 and they were over $200,000 in fees. So I think that the board and I have endeavored to be very frugal with how I charge time and what I get involved in, and the director and her assistants are also very discerning as to what they send forward for me to review. So I'm asking for the rate to be increased to $3.45 to bring it commensurate, and not anything retro, but just basically to say if it had been 7% each year under the retainer agreement, it would be about $3.45. That's what I'm asking for.
Mr. David? I would just like to state that I do not recommend that we increase. And I recommend that, we consider putting out to bid and seeing what other options are out there for legal counsel.
Ms. Davis?
Mr. Chairman.
Hold on, one second. Are you finished?
Yes.
Ms. Davis, you.
Ms. Coleman, charges us for gas back and forth, she again has been receiving 4 to 5 times what the attorney used to get that represented us 4 years ago. So, I'm definitely opposed to it.
Thoughts?
The same, the fees are I'm going back to just this. And I know some of the fees and why they occurred, but I have to agree some of them appear to be lengthy. And I think going out to bid, if we did that, then we can compare and say, okay, these, what she's asking for is comparable. I think before we make any decisions, we need to maybe rein in some of what we use our attorney for and see what kind of bids we can get, what kind of work we can get. I think it all needs to be looked at.
I agree that it definitely needs to be reined in for what we're using counsel for.
Yes, Mr. Chairman, we've literally been using our attorney for an advisor. Like an employee, practically everything gets sent to her. Any sunshine request gets sent to her, everything gets sent to her, back and forth, back and forth, back and forth. That's why her fees are so exorbitant. If we do look at other attorneys, options, you know, I would think that's a good idea.
Know that the fees appear to be high in some respects. I can't disagree with some of the things that have occurred because there's a lot of expense when there's board member questions a lot that are answered by Ms. Coleman. And, you know, there's a healthy amount of that in the bills, as you're well aware of. Can't argue too much about some of the other things that look like maybe a little, doesn't always hurt to go out the bid. What do you think, Mr. Deal? Do you have anything else on that?
No, I'm willing to go with what the majority of the board decides to do.
So how does that work?
Well, there's a first and second on this motion to recommend approval for increase the attorney hourly rate. Let's have a vote on that. And depending on that vote, we'll have to have a second motion. Depending on where that vote is, we'll have another motion. Is there any other discussion?
Mr. Chairman, is that on our agenda that we would be considering a raise for the attorney?
Act on recommendation to approve increase of attorney hourly rate. Number one,
Flip the page over. No wonder.
sorry.
Okay, I thought that's all we had was one page. Okay. Gotcha.
All right. You good? Okay. Is there any other discussion points on this matter? Not hearing any, I'm going to request a roll call vote on the motion.
Mr. Peg,
I'm going to say yes.
Mr. Deal,
Can, we have to vote on this, or can we table that and bring up another?
He's asked for a vote. Mr. Beal,
Thank you.
the discussion's no longer.
I vote yes.
Ms. Stidham,
No.
Dr. Henry,
No,
Ms. Davis.
Nope.
So the motion fails. Now I'm going to request that we have a motion that we go out for bids on the matter
I make a motion, we go out for bids on the matter.
I'll second.
for attorney representation.
Yeah, correct.
Having a first and second, is there any discussion on the matter?
So, Mr. Chairman, does that mean that we will be looking for other attorneys? And asking for their rates,
That means we.
or just doing a survey?
Is it- What was your motion again?
It was to go out for bids.
Bid
That
from
means
other
you-
attorneys?
Yes.
Okay.
So if we do that, Christie, will you be able to continue to work with us until the decision's made
Yeah,
at the current rate?
I can't raise it on my own, so.
Okay. Just want to make sure we have representation if we need it.
Is there any other discussion on this matter? Not hearing any. I'm gonna call for a roll call vote on the motion to go out for bids for attorney services for the Jersey County Health Department.
Mr. Peg,
Yes.
Mr. Deal.
Yeah.
Ms. Stidham?
Yes.
Dr. Henry?
Yes.
Ms. Davis?
Yes.
Motion carries. We will do such. I'll work with whoever's, the legal committee will work on this together. No problem. All right. Next on the agenda is approval of the grant application for the Jefferson Foundation. Need a motion, please?
I'll move, for the board to approve the grant application from the Jefferson Foundation.
A second?
Having first and second. Any discussion on the motion?
Mr. Chairman,
Yes, ma'am.
correct me if I'm wrong, but I thought I saw some wording in there, mentioning the homeless for that grant. That was mentioned in the grant.
Ms. Ball, you want to explain what the grant's about, please?
I was gonna say, I'm sorry to interrupt. I had actually would like Melissa and Katie to come up. They are spearheading the writing of this grant. And just as a, update, the new bylaws call for any grant requests that were over the amount of $100,000 to be brought to the board prior to us submitting them. This grant will be due, I believe February 8th. And so we are looking for approval this evening to be able to push this forward. But would you ladies like to talk about it?
Sure. The Jefferson Foundation offers 2 rounds of grant applications each year. This first round allows for us to apply for program support options. We have applied for this grant each year since, I think I put in there 2016, and been awarded each year since then. The primary focus on this program support grant the majority goes directly to patient care services. So we utilize this funding for individuals who don't have insurance, who can't afford to pay. It covers laboratory services, which we send our labs right now to a commercial lab. So the cost is still there for those laboratory, for the lab tests to be performed. And a lot of folks have difficulty paying for that. So that's a large portion of where that funding goes. It also helps us be able to provide services at the unhoused events, and be able to do primary care, do dental care, for those individuals who have no means of paying for those services and don't have insurance and may not have state funded Medicare services.
So yeah, I noticed it on the last page there. That
Ms.
that's-
Davis, could you please hold your questions to the
Sure.
end? Thank you. Let them finish up with their
Go ahead, go ahead.
presentation. Thank you.
So last year, when we wrote for this grant, we wrote for the full amount, 250,000. We were awarded 175,000. Each year that we have written for it, we have used the full funding. It is primarily focused on our clients, our patients, doing what we can, and fills a gap for those services for maybe programs that don't cover their healthcare needs. So some of the areas that we will focus on this year is trying to be able to continue our mobile services and providing those healthcare services directly in the community at events, at food pantries, at schools, at locations where we can meet folks where they are. So if there's transportation issues, if there's resource issues, we want to still be able to provide those services. So some of the program support pieces include nutrition management, primary care, dental care, vaccines, treatment for further advancement of conditions. And then we also have a program called Project Lifesaver. And we've highlighted that program on a couple of occasions. And right now there's no funding to support that program, but it helps save lives in the community by providing a way to monitor individuals who may have dementia or other issues that cause them to maybe wander off and need to have a way to locate them. And we have had some instances where that program has saved lives. So we want to continue to be able to provide those services, even though we don't have a direct funding source for them. So we're asking for approval to write for this grant. The application is due, as Ms. Bowmore said, February 8th, so we have a short window in which to write for this. Katie and I will be writing for this grant together. And Katie's been involved with the direct client services portion of our program support grant for year after year. Yes, we got it. So she does see the direct impact on those patients who are walking through our doors that we're able to use these services for.
Do we offer the little bracelets? Is that part of it?
That is Project Lifesaver. Yeah, yep. Right now, I think we have 15 participants in that program.
Any other questions? Ms. Davis, you have a question?
Yes, you stopped reading, after you said, and life-saving prevention services, and then it goes on to say for vulnerable populations, including the unhoused.
That's correct.
Yeah, and so, I'm finding out, talking to a lot of them now, that nobody has their paperwork. And so it begins with the birth certificate, which Jefferson County Health Department.
Mhm.
And we've been to several events already where we've provided care or services for the unhoused community. We send an OSA to those events that Jillian goes to.
Mhm.
And we've been doing birth certificates for those folks for probably 3 or 4 years now.
So hypothetically, they have a cell phone, they can call, make an appointment, and that van come by their location. They don't have a car, so they're in encampments, whatever. Can the health department?
So vital records is a little different than providing,
Medical care.
medical care. We are required to follow the state guidelines for vital records, which means that we have some limitations on when and how we can provide those, and that's out of our control.
So there wouldn't be availability to do any type of a mobile?
No.
Okay,
No, vital records have to be in-house.
okay.
We can go and we can take the applications to some of
And
those
then take them back here
and then we can
That's what
take them back.
and maybe
do them.
send them to us.
Well, we usually go back and drop them off to them before the event's over.
Oh,
Yeah,
And this funding source is how we've been able to do that in the past.
Yeah.
Because there's still a cost associated with it.
sure.
okay.
So if somebody needs their birth certificate, do they need to prove who they are? They don't even have a state ID yet, so. Like
There's
the
a
cards.
We've actually had a lot of good experience with that, but there is a process and there are required documents that the state will accept.
Ugh. Yeah, here's what I'm hearing, okay? They end up in jail, get out, their stuff's gone, all their papers are gone. Or they walk to town to get something that they needed, and they come back, their things are gone, paperwork's gone. No identification, nothing. And, the beginning of getting help as an unhoused person is to have all your documentation and then apply for housing and or services, and they have nothing.
Yeah, and unfortunately, there's not a lot that we can do on that because it is a state statute that they have to provide identification. But there is a super long list of things that we can accept. And they can also have direct family members who share parents, aunts, uncles, grandparents.
Identify them?
Yes. They come in.
We're getting off a little bit of the topic here from what we're doing. Let's get back to the application of the grant. We know it's all good ideas. Like I said, but we need to stay on our target here. So is there anything else you guys have?
Unless you have some questions about the grant application or the purpose or intent of this application.
When do they make the decision?
I think we usually hear in April, and it typically goes into effect June 1st, I believe, is this cycle.
Okay, thanks.
All right, so we have a first and second I'm sorry, is there any other questions? Sorry about that. I'm not hearing any, so we have a motion to approve the grant application of Jefferson Foundation. All in favor, please say aye.
Aye.
Any opposed? All right, motion carries. Next on the agenda is act on recommendation to suspend bylaw requirement for RFP to rebid soil testing commensurate with our budget. I asked for this. Ms. Coleman, is there anything you'd like to?
So what happened here is that we got a rough estimate to place in the budget on the line item for soil testing. And now we're at the point where we're ready to do that, and the services are going to cost considerably more than what was budgeted. So, and your
Not
current,
considerably more.
well, the original.
I guess there was one bit, I guess, when
Yeah,
it first came in
Yes,
was a lot,
yes, yes, yes.
but since then, go ahead,
They've gotten, they may have gotten
more in
more
line.
reasonable in what they're wanting to do. So, your bylaws require that the director can spend up to 25,000 without taking it to the RFP process. Anything above that has to be RFP and then bids are placed. So, what we talked about doing, because this is very time sensitive and it's going to exceed 25,000, is suspending the requirement for this particular item and potentially for a range of costs associated just with the building project, such that you don't go out for the RFPs, but your contractor and your architect are allowed to solicit bids. So, for example, what you could do is you could say anything from 25,001 cent to 50,000 as it pertains particularly to the building project. The architect and the contractor have the right to solicit bids as opposed to going out for RFPs. But right now, your bylaws don't allow you to do that. So because you're going to go over the budget, right now you would need to go through the RFP process. Now, the other part of that is that you do have contingency funds built into the budget, which would normally kick in. For example, let's say you did an RFP and you got bids and you hired Acme soil testing to do your soil testing, and they came in at $30,000 with their bid. By the time they actually started to do it, it's lo and behold, it's gonna be 40,000. Well, your contingency funds allow you to move 10,000 into that to go ahead and continue to use Acme because it was an unforeseen circumstance, it's like a change order. But we don't already have an Acme hired to do the soil testing in this particular circumstance.
So the main reason for this is because it's gonna speed it up. They need to get moving, obviously, with soil testing. This is just more than soil testing, by the way. There includes quite a few other tests that involve throughout the entire process of the building, including concrete testing and steel testing, that sort of thing. But, you know, if we do this, it'll be 3 weeks down the road before this gets moved, and that's gonna push them back 2 to 3 weeks at least, probably a whole month. And I'm just wanting to get it done so we can get it in there. The cost, I think we budgeted 30,000, and I think the cost is the one bid come back, or quote come back at 31,000 and some change. So it's really not absorbed, it's just we're still gonna get quotes. We're still gonna get 3 people to give us quotes, okay? But there are already quotes out there. I think you have them. You have the quotes if you wanna give them to everybody. They're already out there, so it's not that we're bypassing the ability to make sure we get the lowest cost container, but it's just
Okay. We have a solid bid from the builder
right.
company
This is
for
different.
X amount of dollars.
Right,
That's his responsibility. to
Not-
deal with
not
all
us.
of that.
not on the soil testing. See, when you get into
Did
testing,
it say excluding soil testing in the contract?
can I
with them?
explain this to you? So the testing is never done by the contractor. Because you want a third party coming in, outside person to come in and do those testing. It covers them as well as us. If you have the same person doing that, not that this company is unscrupulous, but some people are, and they can say those tests were okay. You have that, you have that occur sometimes, and it's occurred with some other places where they say the tests are okay, and the concrete's crumbling. And they weren't because somebody did a little fudging, and we all know that. So this company takes it upon, they take that onus to say, concrete's good, it's in their back pocket, it's their liability. And it just covers, that's why you do and have third parties. And no, it was not part of the testing is always, as your architect would tell you, is always done by a third party. The architect's the one that actually started pushing, and going through and saying, hey, here's bids for these guys, and here's quotes for these testing companies. They're the ones who started pushing it back. It's not part of the building. It really isn't.
I agree to disagree
Okay,
because
well,
when you hire someone, that's all the things that they do for you. And, you know, this,
We actually,
for this doesn't fit well with me. What
Actually
is it, a
put-
$7 million bid?
we actually put dollars,
Promise to pay.
you don't listen to me, we actually put dollars, monies in for testing. It wasn't part of that. It was $30,000, I believe.
So
we
this
put
one's
in.
only $1,700 more.
So. All right, is there any other discussion on the point?
So we already have bids?
Yeah, they're right there.
Are they gonna get-
Your contractor called a few
Quotes.
people all around to get some.
Taylor, I would call them quotes
Yeah.
versus bid.
So is it up to them or up to us?
It's up to us. We've gotta accept it.
Why aren't we able to keep within the bounds of what we already have allocated?
What do you asking?
$17,000 difference, why can't,
It's $1,700.
are any of those bids within that range so that? we
That's
don't
the
have to-
close, that's the closest. Well, when you put stuff in, you always budget, you try to get close to it. Sometimes things come in and you have quotes that are, it's, the first one they got was extraordinarily. It was like $80,000.
Yeah.
That's crazy, you know, even I'm like, ooh, hold on. But yeah, I mean, you try to, when you make a budget, you think, best guess, this is what it's gonna cost us. When we did the entire building, our best guess was X dollars, and I think we're pretty close to staying in that well, which is, but we did other things to stay there too. We cut back on what we were building. So I do understand the cause for concern, but it's not a big concern at this point. The concern is that we're not gonna move forward on the building, and we're gonna delay that operation, getting things moved forward. So is there any other discussion points?
Just
So
for clarification, oh, I'm sorry. Okay.
I was just gonna ask, so all of these are acceptable to the architect and the contractor?
Yeah, and that's the thing, you gotta rely on your architect, because that's what he helps do, is help manage those sorts of things coming in, because he's in the game a lot more than we are.
And the only one that includes the fireproofing and others there is the PSI, is that right? The other two
Yes.
don't?
And that's when the budget was made before I got on there. It was 30,000 for the testing. And then there's another little spot over here that has money for these kinds of things where it wasn't budgeted under or over. And there might be something else that comes along that it's under budget. So 1,700 was over what the 30,000.
1,700, not 17,000.
1,700.
1,700. All right,
We're good.
not hearing any further discussion on the matter, all in favor of suspending the bylaw requirement for RFP to rebid the soil testing?
Did we get a motion?
Well, we had a first and second before we discussed this.
Yep.
Did you miss that?
I guess I did, I'm sorry. Who was it? I don't know.
So,
I
all in
apologize.
favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. All right, next thing on our agenda is entertaining topics.
Do we need a motion to accept the bid?
That's what she's saying, we didn't,
I don't remember.
we just
We
went
didn't
right
make a
into
motion?
discussion, we did not make the motion and
How are we discussing it then?
because we went out of order, I'm guessing.
Because we had a motion to
I asked for motion.
suspend the
We
bylaw.
motion
I'm taking my apology back.
suspend the RFP.
He
not to
apologizes.
actually-
Yeah, I don't think we had a motion, because we'd be like,
Yeah, your motion.
Can we do a replay?
I know, for the grant, come
All
on.
right,
Right.
all right. Do I have a motion? Do I
I
have
will
a
make the motion.
motion to approve
He apologized.
suspending the RFP process for the soil testing?
Okay,
You have a
Second.
motion?
I motion.
I said,
Yep,
okay,
whoever
I
second.
seconded.
All right,
all right.
back again. We already discussed this motion, which was a motion anyway. All in favor, please say aye.
I,
Any against? Motion carries.
Thank you.
You wanna make a motion to accept? I don't know, do I have a motion to accept that? No, we can just set the quote. Quote, we can just move forward on
Right,
that.
your contractor has the
I
ability.
already
as
got
long
that,
as it's-
right, all right.
and it would be the 31.
Now we're gonna entertain topics, yes, it'd be PSI. Now we're gonna entertain topics for the next agenda. We're limited to 3 topics. Is there any topics anybody wants to put on for the
Yes,
next
sir.
agenda? Ms. Davis?
I would like to see all the employees of the Jefferson County Health Department get a minimum of a $10 raise per hour.
So you want to have that on this as a discussion point?
Yes, sir, I do.
Okay,
And it looks like we got lots of money in our account to do it. And we also have properties that we can, assets and bonds and stocks and that we won't need to use that. We didn't need to use it for this
I've
building.
got it. Is there any other discussion matters? Oh, is there a second to that? I'm sorry. Is there a second to that discussion request? Because there has to be a second for it to go on. Anybody wish to second?
So
discuss that?
so
Hold on a
on
second.
record,
Hold on a second.
the trustees
Ms. Davis,
don't want to see the employees get a raise
I didn't say that,
of $10.
but is there anybody else who wishes to put that as a discussion point?
I think we need to wait, I think we need to wait until the salary survey is done.
Yeah.
Okay,
And then we can evaluate.
We
what
don't need to
comes in.
evaluate anything. They need a
all right.
raise.
Is there any other, Ms. Davis?
Things are very expensive.
Nobody else wants to put it on the agenda for a discussion point.
So on
Everybody's
that-
wanting, everybody's wanting to wait for the salary
wanna
to start
wait.
making. Is there any other topics for discussion? Not hearing any, do we need closed session? All right, so I am asking for a motion to adjourn.
I'll make a motion to adjourn.
One second.
There's a second. For any discussion points on the adjournment? Shouldn't be. All in favor, please say aye.
Mr. Chairman, you need to tell us what you're closing the meeting. for.
We're not going to close
We're
session.
not going to close session? I'll close the meeting. We're done.
Adjourn.
Okay, because it says on here, close session. Okay,
Well,
all right,
you
okay,
missed it. You missed.
we're good.
What all, I
Close
guess,
the meeting.
cold weather's gotten everybody.
Go ahead.
All in favor for adjournment, please say aye.
Aye.
Any opposed?